How can you transform the shape of your face? How can you look younger? How can you make your TMJ symptoms kind of go away or be much less? How can you get headache relief or neck pain relief? Even if you've had porcelain veneers, even if you've had braces, even if you've had jaw surgery, even if you've had all your teeth ground down, you can still get the JawTrac Jaw Position. This patient in this picture doesn't have it. Basically, she's a beautiful woman, but you're seeing a lot of strain in this lower face. You're seeing that the lower face is shaped a little bit differently, and the cheeks are a little bunched up, and you know, the shape of her face is not ideal. As a plastic surgeon, she realizes that the solution has to be structural. When you look at this face has been changed, the jawline has been changed, the shape of the face has been changed, the shapes of the teeth have been changed. The key that did it all was the bite. She doesn't have facelift dentistry here. She has facelift dentistry here with the JawTrac Jaw Position. This is the jaw position she was always meant to have. So let's take a look at some cases here. This woman has an overbite. Her lower jaw is pushed back. Her teeth, upper teeth, overlap her lower teeth. There's a lot of tension in this, very much like you saw in the plastic surgeon. She is very unhappy with how she looks, how she feels. She has neck pain, that type of thing. A deep overbite can be corrected beautifully. This patient also has an overbite, but her chin is pushed back just like the previous patient. Her chin is back. She has a recessive chin, her neckline, the shape of her face. She doesn't like how this all looks. She got this treated without a single tooth being ground down, without any surgery. It was done in just a few weeks. This man has facial collapse. He has an overbite. His teeth are worn down. His lips are pushed out. He can't enunciate his words. He doesn't breathe as well. He doesn't sleep as well. He doesn't have room for his tongue in there. His chin is too close to his nose, just like most seniors. Most of us have our chin too close to our nose. When that happens, there's not a lot of room for our tongue. And when there's not a lot of room for our tongue, our airway is a little smaller, we snore, we have all sorts of problems. Now here's what I didn't say. I didn't say the facelift dentistry can solve everybody's snoring problem. I did not say that, but it certainly can help if you get this jaw in the right position. This patient has an open bite. When she's biting her teeth together, all of these patients, by the way, when you look at the pictures, they're all biting their teeth together, but with open bites, that's why we call it open, none of these front teeth can touch. For those of you that don't have an open bite, it'd be hard for you to perceive this, but she can't eat, she can't speak properly. She has to grind her food in a blender. She's been eating blended food for 6 years. She's facing a double jaw surgery. She says this was caused by orthodontics. She's been wearing braces for 6 years. I have 20 years experience with orthodontics. The first visit I saw her, she had the braces on. I told her, get them off. And then we will go from there. You will see all of these cases in a few minutes. This is once I get to it, maybe shorter. But she has an underbite. You see how the lower jaw is out front of the upper jaw. Her chin's too close to her nose. She doesn't like how she looks. She doesn't like how she smiles. There's all sorts of issues with this bite. Underbites. This is a doctor that flew in. He's a Harvard graduate doctor. He's a surgeon. He realized that the non-surgical technique is the best way to go. None of his healthy teeth were ground down, just like the girl in the previous picture, which we'll get to when you see her after. But this is a surgeon that flew all the way from across the country in order to get the non-surgical facelift dentistry, JawTrac Jaw Position, Venlay restoration method. This patient flew in from Ukraine. She went all over the world. She went to London, and she went to Switzerland, and she went to Germany, and she went to all the various countries. Everybody said, to fix this misaligned jaw, to fix this underbite, because her chin is pushed off to the right. She doesn't speak well. She's not comfortable. Self-esteem's an issue. Here she is. Take a look at this. This is facelift dentistry treatment with no shots. That's right, she didn't need a shot. Look at her new jawline. The jawline here, this is the key to the facelift dentistry method. It is all about the jawline. So when you look at this after face and you see the bite, it's all related to the bite. Your bite determines the shape to your face. And when your face is too short or when your jaw is aligned, chances are quite high by fixing the bite, we can change the shape of your face by three-dimensionally getting this jaw in the jaw position it was always meant to have. This is the jaw position she was always meant to have. She has a knockout smile, she's comfortable, she feels much more confident about herself, and the doctor with the underbite no longer has the underbite. When you take a look at him with his new bite, that he has an end-to-end type bite that was custom built just to suit him, so he would show just the right amount of display when he's talking with the upper teeth. You'd see just enough upper teeth and just enough lower teeth. He looks natural, he feels comfortable. This is the jaw position he was meant to have, and all the teeth were redesigned to fit the jaw position he was always meant to have, and that is the JawTrac Jaw Position. That's the secret to this method, is getting someone's jaw first repositioned and then putting porcelain over your teeth. Your teeth are not ground down, it doesn't hurt. It's pretty quick, done in a month most of the time, unless you need a ton of dentistry. Here she is. I told you were going to see it. She has an underbite. Her jaw is pushed forward. Her natural jaw position is not forward like this. The bite, her teeth, forced her jaw into that position. I redesigned her teeth to her new jaw position. She has the smile. She has white teeth. She's comfortable. She's confident. She doesn't have TMJ pain. Her underbite is gone. This was all done in about a month. And again, no shots, no surgery. And you say, wait a second, this is too good to be true. I get it. It sounds too good to be true, but it's not. This is basically true. You're looking at patients that have had this done, and they were not paid. These are not models. These are not paid patients. These patients did this exclusively for you. They did this so that you would benefit, to be able to see that this is for real. This is beautiful dentistry. And here's our open bite. She's biting her teeth together in this picture. She's biting her teeth together in this picture. This picture, she can't eat, she can't chew, she can't speak her words. This picture, she's a new woman. Now, could you imagine a surgeon willing to do a double jaw surgery on someone that at the time was about over like 65 years old? Would you do that? But patients are desperate, and she was desperate. She wanted a solution, and she was told that she had to come to my office and basically get the facelift dentistry method. I can correct, this is called an open bite. I can correct open bites in a matter of a month without grinding down your teeth and without jaw surgery and braces, by redesigning the shapes of your teeth and establishing the JawTrac Jaw Position. That's the position you were supposed to have and never got. So here she is, our patient with a recessed chin, now has a strong looking chin, same jaw, same face, but a whole new person. You can be a whole new person if you ever get your jaw in the right position. Most of us, we have a bite the way we have it. It forces our jaw to close, forces our chin back if we have an open bite or an overbite, and our chin looks small when the chin really is not small. This only looks small because she's in the wrong jaw position. This looks big because she's in the JawTrac Jaw Position. You already have the jaw you need most of the time. It's just a matter of getting it in the position it belongs. That's what the facelift dentistry does. It takes you from a bad position, puts you into a healthy position. You tell me that you feel much more comfortable in this healthy position, then we build it. Aging faces look the same. The shape of the face starts getting round, the lips are pushed out, facial wrinkles. Look at the proportionality of this face compared to the proportionality in the after face. Look at the jawline in this after face. That's why we have the 3 lines on it to show the accuracy of this method. Because basically, when you look at his lips in both pictures, they're the same lips. You look at his jaw in both pictures, they're the same jaw. You look at his face, this is the same face, and only about a month apart. This is facelift dentistry. It's not porcelain veneers. Porcelain veneers cannot do this. Never is going to happen. Orthodontia can't solve this. Jaw surgery can't solve this. Facelift dentistry solved this by taking a look at the choices that you have as a patient. The choices you have as a patient are grinding all your teeth down. After they grind it down, most patients still have this face. We want to go above and beyond what most dentists are shooting for, which is just give you some white teeth. We want the jawline. The jawline is the key to looking younger, to feeling younger, to being more comfortable, to being more confident. Sure, you could have put porcelain veneers. That face would still look exactly the same. When he's relaxed, when he's listening to you talk, you're seeing an old face. Look at this. This is a sharp man. He sent me an email recently that said he absolutely loves it. It was done, years ago, and he just wanted to let us know how happy he is. And I want to thank all these patients again. None of them were paid. These are real patients that did this exclusively for you. They're letting their faces be on the website to make you understand this is for real. Look at her. I had a dentist that said, I'm using a model. He put a complaint in. I think he was a San Diego dentist, she put in a complaint into the state board saying, I'm using a model. Well, guess what? I'm pretty honored that a dentist could be so impressed with the results to say, you can't go from this to this without grinding down teeth, and you can't go from this. This is a model, he kept saying, but he was wrong, totally wrong, or she was wrong. So the point of it is that facelift dentistry is so good. It has so many advantages that you just won't get. You can go to the cosmetic dentist and get some porcelain veneers. You're keeping this face. That's the key. If you want to go from this to this, and by the way, the teeth soften a little bit. They were just put in her mouth. They're whiter than they normally would be. And that's typical of all my cases. And all the dentists that do porcelain work, the porcelain fades a little bit as the years go by. So it loses its opacity. This porcelain just came out of an oven like a day or two ago. And so it looks whiter than what it really is. But she loves it. Back to our plastic surgeon. Look at, again, the shape of the face. Look at how her chin, look at her lips. A dentist asked me, well, wait a second. In between these pictures, did she have her lips augmented? No, nothing was done between these two pictures. The difference is she has teeth inside her mouth now that support her face. That's why I call it facelift dentistry. It's designed to support your face. It's the way your teeth should have been. But as I've said in other videos, your mother didn't have a computer nerd inside her body dialing in all your shapes of your teeth, the length of your teeth, your jaw position, your face, the shape of your face. There was none of that. It's all an accident. And you can have braces, which she did. It didn't go well. And so my point of it is that get the teeth you were meant to have. Get the shapes, the color, the length, the sizes. Get what you were meant to have. Get the JawTrac Jaw Position. Take a look at this. You're looking at her. She's biting her teeth in both pictures. That's the point I keep making. Same face, same jaw, same lips, but a whole new person. I do facelift dentistry. JawTrac is the jaw position that we give you first to test, make sure you're comfortable, make sure your TMJ or whatever issues you have are less. I didn't say I could solve all of your problems, because basically if you're a 60-year-old, you've beat these joints up, there's things that are going on that I find that if we can get this jaw in the right position and get the bite built to it, a lot of the other things are less intense, less headaches, less jaw pain, swallowing better, sleeping better. I mean, how can you beat that? Venlay restorations are for bite correction non-invasively. Obviously, porcelain veneers can't do that. Venlays do that. And basically, the dental facelift is the same thing. Now, patients say, am I a candidate? Hey, hey, look, 99% of the patients I see are candidates. Bottom line, 99% of you are candidates, and the other 1%, I might think that a jaw surgery could serve you better, and usually they look me right in the eye and said, I'm rejecting jaw surgery, I'm not going through that, I'm not going to take the risk. Even though you think jaw surgery potentially could give me a better result, I'll take your best shot right now. All right, we could kind of go to 100% if that's the way you're thinking. And so bottom line is, are you a candidate if you had veneers? Yes. Are you a candidate if you've had all your teeth ground down? Yes. Are you a candidate if you've had jaw surgery? Yes. Braces for the third time? Yes. Invisalign for the third time? Yes. If you've never had a single thing done, are you a candidate? Yes. 99%. Get on a plane, because basically, I'm getting ready to retire. And that's the bad news for a lot of you. I'm retiring because I've been doing this for 46 years and I want to kind of free up some time so I could teach this method. I'd like to teach this method on a large scale, and I'd like dentists to be able to learn how to do this. And the patients keep telling me there should be a facelift dentistry center in every major city. Well, okay, I don't want to do that. Sorry, that's just not what I do. I'm not a big time business guy, so I don't really want to set up and go through all of that. I want someone else to do it. So hopefully I see you, and I hope I've educated you and showed you a method that you can't get anywhere else, no matter what the dentist says. And so just keep in mind that if you're letting someone else work on you, the bottom line is you're giving up something. I don't know what it is, whether it's the finish, because I just saw a man yesterday, his husband and wife and kid came in, and the husband said, see, I just had all my teeth done. See? I said, yeah, but you didn't get the JawTrac Jaw Position. You got all your teeth ground down. You have the same bite you walked in with. You have the same face you walked in with. I said, there's no room for your tongue in there. I bet you snore and you don't sleep very well. And his wife just was bowing her head, yeah. So a lot of times I want to caution you, your dentist could be a wonderful person, a very sincere person, and an excellent dentist, but they don't do facelift dentistry. My name is Dr. Sam Muslin. Thank you for listening.